So a question I get asked a lot is, what are the differences between PRP versus PRF? So first off, PRP is platelet-rich plasma. PRF is platelet-rich fibrin. So they're both platelet regenerative treatments. The main applications for PRF are either injection or microneedling. When it comes to injection, we can inject it pretty much anywhere, but the main areas that I see are going to be the under eye, the lips, the folds around the mouth, as well as the scalp for hair regrowth. There's now a third generation of PRF called PRF Gel. This is essentially where we take the PRF that was already created and then we heat part of the blood and we cool part of the blood and we mix it, and that albumin product that gets mixed is actually 100% natural still from you, but forms more of a gel which can be used like a natural filler. Right now, the most common types of fillers that are used are dermal fillers. Dermal fillers are hyaluronic acid based, but they are synthetic. So this is like a natural alternative. Now with PRF gel, using a natural filler is going to have different results. It's going to have a more soft look, a more natural look, because it's all about stimulating collagen. Botox is actually a brand of a class of medication called neuromodulators. Another commonly used name for neuromodulators is wrinkle relaxers. And wrinkle relaxers are used in the areas like the frown lines, the forehead, around the eyes, and that's probably what people mostly know about Botox for, but it can also be used in other areas like the chin and along the jaw, into the neck, above the lip. And then for therapeutic reasons, it can also be used for the jaw for over-clenching or TMJ issues, for the upper trapezius muscle for tight muscles there, the calves for calves that are too tight, and anywhere else actually that has over-contracted muscles. Starting preventative aesthetic treatments in your 20s and 30s is actually not too early, and that doesn't need to be injectables. Things like platelets are an absolutely natural treatment that can be used at any age. Some of the benefits of starting preventative aesthetic treatments early means that we can basically maintain the skin health as opposed to trying to correct it. It's like trying to reverse sun damage is a lot harder than just actually protecting the skin from covering it up or using sunscreen. Oftentimes we end up not thinking about these things when we're young and then regretting it when we're older. So it's definitely a lot better to start when you're young and start by protecting the skin and then maintaining the skin. Some of the treatments like microneedling and platelets can be really great to just maintain and prevent. I also love adding in a little bit of Botox when you're ready, maybe in your 30s, but it depends on every person. The main difference between Botox and fillers is that Botox is a temporary procedure that's going to address areas of expression lines. The most common areas are going to be the frown lines, the forehead, around the eyes. Fillers are going to address volume loss, and volume loss can occur in lots of different areas of the face. For those looking for a more natural approach to dermal fillers who aren't wanting the synthetic hyaluronic acid, PRF gel is a great alternative.